If you want to know why you're getting tension headaches and how to fix them, listen to the end. We're going to talk about the upper cervical spine, which is where a lot of our postural headaches, our tension headaches come from, which is essentially 3 different bones: the occiput or the skull or the cranium, C1, also known as the atlas, and C2, the axis. And in a little bit, we're going to talk about C3 also, which is the segment down below. So the first joint we're talking about is the Atlanto-occipital joint. So where our skull meets our atlas. Now this is our yes joint. So if this is restricted, we'll have a restriction usually in going down. We can't tuck our chin real far. The nerve, which is called the cervical trigeminal nucleus, will correspond to the top of our head. So if we get a headache, we're going to see it like here. Right? If we get jaw pain coming from our temporalis muscle, this can refer back to our skull and vice versa, because this is a two-way street. Unlike some nerves, this can go either way. So if we have not enough room between these two, it's going to pinch that nerve. So if you see this here, there's a decreased space, and those muscles that correspond with it will also tighten down and pinch the nerve. So our second joint that we're going to talk about is the atlantoaxial joint. So where the axis, which is the C2, and the atlantis, which is C1, sit on top of each other. So this is our no joint. So half of our rotation in our entire neck all occurs at this joint. If there's restriction there, you can have a pinch between the vertebrae, pinching a nerve, but you can also have muscle tightness and muscle pain. So the C1, C2 will come around to our mid face. So to like around our, right below our eye sockets, into here, into our ears. So if we're getting a headache from here, we can get upper jaw pain. We also can get even eye pain, pressure in our maxillary sinuses right here. The last joint we're going to talk about is C2-3 joint. The C2-3 joint is our maybe joint. So this is where this motion occurs. So a lot of times I see people who have TMJ pain, they'll be tipped one side all the time. Well, that means that my left C2-3 joint is being compressed, and my right C2-3 joint is being overstretched. So we would try to level them out. This headache pain will come to the lower part of our head, come around and into our lower part of our jaw. Now you know what's going on. Let's fix these mofos. All right. So the first one we're going to talk about is the yes joint. What you're going to do is you're going to take your hands, put them in the back of your skull, like in the soft spot. So right down, there's a little soft spot there. Once you're there, you're going to pull up gently. This is a few pounds of pressure. And then tuck your whole head. So you're trying to retract. You're now doing a gentle chin tuck. You've probably heard of these before. Holding for 6 seconds, and you're going to repeat it 6 times. That should be not painful. It should feel good. Don't do it if it doesn't feel good. Our no joint. So if we are restricted, so if we drop down our head and we're restricted one way or the other, this is what we're treating. So in this case, we're going to say I'm restricted to my left. So I'm going to take my right hand, put it down in the back of my head, right below the skull. My thumb's there. Now I'm going to gently push with my thumb as I try to gently rotate. Again, this should not be painful. It should feel good. So the last joint we're going to talk about is the C2-3 joint, our maybe joint, right? So we would be restricted in tipping one way. And in this case, we're going to pretend like I can't tip to my left. And that's because most people have problems tipping to their left. I'm going to take my left hand, and I'm going to grab the back of my skull. I'm going to show you guys from behind. At the back of my skull. And I'm going to tip. Okay. So I'm gently pulling on my head as I tip to my left. Holding that for 6 seconds. Repeat it 6 times. If you want further guidance, click the link in the bio. See you guys all soon. Thanks.